I'm Jeremy Davis. I'm a consultant ear, nose and throat surgeon at Medway NHS Foundation Trust, and I'm going to discuss the inclusion of grommets for hearing loss in the NHS Evidence-Based Interventions programme. Grommets are small tubes that we place in the eardrum under a general anaesthetic. They allow air into the middle ear and any fluid there to disperse to help hearing. However, in many cases of glue ear, which is what we're doing this operation for, the fluid will disperse on its own, and so the hearing will come back to normal without intervention. The use of grommets for glue ear is largely carried out in children, although occasionally we have to use it in adults. In children, it's to help speech development and their hearing for those who've got persistent glue ear for longer than a number of months. There are other reasons why we sometimes have to use grommets, and they are covered in the EBI documentation. Grommet surgery does carry a risk of infection, a persistent hole in the eardrum, and sometimes the need to remove or replace a grommet. So it's not without a small degree of risk. And so we should only be using it where it's actually going to provide benefit for the child. I specialise in the treatment of ear, nose and throat conditions, including head and neck cancer. For me, it's important that grommet surgery for glue ear has been included in the NHS Evidence-Based Interventions programme, as this will clarify which children should be referred to us as ENT surgeons and which can be treated by the general practitioner. I and my colleagues in ENT UK strongly support the inclusion of grommet surgery for glue ear in the NHS Evidence-Based Interventions programme to ensure we make the best use of scarce resources.